right? You got to kind of get a good structure on how you're going to deal with it, how you're going to approach it, and if your leadership is on board. So prior to maybe even doing a policy, you might have to have a strategy type of discussion about how we're going to do this organizationally, because the policy becomes only one part of that strategy.
Welcome to Embracing Digital Transformation, where we investigate effective change leveraging people, process, and technology. This is Darren Pulsford, Chief Solution Architect, author, and most importantly, your host. On this episode, building your GenAI policy with returning guest, data privacy and GenAI lawyer, Jeremy Harris. Jeremy, welcome back to the show again and again and again.
Yeah, hey, you know what? You keep asking me, so I will keep coming, Darren.
Well, it's such a hot topic, and I think in an earlier discussion I've had, GenAI has just gone woo crazy. We need some guardrails around it. So I got to call my lawyer friend that has worked in this space. I mean, this is your expertise. Your expertise is data, privacy, generative AI. I mean, this is. So I want to get to some brass tacks today.
Okay. We can do that.
Is that okay?
Yeah.
All right.
Yeah. Let's go in.
All right. Because I need a GenAI policy for my company, but I'm not healthcare, but let's pretend like I am healthcare.
Okay.
So because I use generative AI a lot, as you know, but should I have a policy? I'm a startup. I got a production company. I'm a startup. Or if I'm a established company, do I need a generative AI policy, or can I just ride on the data policies I already have?
It's actually a really good question. I've had debates about this. I think the prevailing idea right now is you actually do need a separate GenAI policy. It can borrow greatly from those other policies. It's complementing what you already have. But I do think you need a GenAI policy because the way that generative AI works in the systems that we have is a little bit different than what we've had before, right? So
explain exactly, because I mean, I would think that a data policy would be sufficient, right? It's data.
Yeah.
I have data privacy. So what's different about generative AI?
Well, data is data. I mean, we'll start there. Data is data. You're going to give data. You're going to lend data. You're going to sell data. You're going to use data, whatever that looks like with your vendors, especially. Once you start with the generative AI, you lose control of data faster than ever before, right? So, like, let's say I have, we could use a healthcare example, right? I have a medical device vendor. I have a medical, or I guess an EHR, EMR, whichever you want to call it.
Okay, right. Electronic
health
medical
record
healthcare record.
Or electronic medical record, either one. I'll use EHR because that's the one I normally use. So if you have an EHR vendor, well, okay, you're giving data, but you've already gone through that contracting piece. You know that you're giving that data. They're protecting the data. You have that SOC type 2, likely, like you have a lot of controls right in place. That's going to follow your data classification policy. It's going to follow your data retention policy. I don't necessarily know what doctor or nurse or payment coordinator, whoever it is in my company is doing when they log into ChatGPT. I have no idea if they're cutting and pasting, uploading a spreadsheet with whatever data. So that's why I say, in some sense, you lose control of that data a little bit more randomly or quickly. And unless you've thought through this, you won't be able to use the full potential of GenAI without having a large risk. So I do think you need right now it's just heightened the risk. Everything's a little bit more timid, or a little bit more insecure, I guess, the feeling, right? Not necessarily the data, but the feeling is everyone's a little bit more on tenterhooks. They're like, oh, what are we doing with this? We really want to get ahead of this. We really want to use this. We don't want to be left behind. And that's that quick pace, right? You just need to slow down and make sure that you have a policy. You've thought through what you're going to do with the data, who controls the data, can they train on the data, those types of things. So an AI policy is usually going to be the time that you have to look and strategically look at, hey, what are we going to do with AI?
Okay, so what you described there was doctors using public GenAI that's out there. Yeah. So cutting and pasting, it would be almost like cutting a patient's name into a Google search. Which I mean, or in Facebook, when you know your patient is lying to you when you say, how did this happen?
Yeah, right,
And they're totally
right.
lying to you. And you
Oh,
go on
look.
to Instagram and find out that, oh, that's what really happened, right? Because
Yeah.
they were riding a motorcycle on fire, jumping through hoops,
Hmm.
over buses, right? And
Right,
like, oh,
right.
okay, that's what would really happen.
Yeah.
Is that unethical to do that? I mean,
Well, the reality is, yeah, it might be, but the reality is it hasn't been helpful to do that ever,
you're right. It hasn't. But
right?
now,
It hasn't been, but exactly like I said, the pace has increased to such a point where it actually might be helpful. If you have an agentic AI like in ChatGPT 5 and you're starting to use these agents, you kind of set things up on your personal thing because you're really curious on how to use it. Unless your system has blacklisted the AI sites, you're going to have access to those sites, right? And most of them haven't. Most of the companies I've talked to have not blacklisted specifically those IP addresses. So what you're doing is now a couple of them actually have, and I've had some interesting conversations with colleagues that it's actually been really helpful because they have approved and gone through things and they know where their data is going. And I'm like, well, kudos to them. But most of the companies I've talked to, the data just isn't quite that secure. And so when you're doing this, yeah, the doctor's like, hey, you know what? This actually could be helpful if I know something about this or know something about, let's get a trend. Like, I just want to run a trend. I'm not very good at Excel. So I'm going to upload this file and I'm going to ask ChatGPT to trend this. Well, they don't think to take out any of the identifiers, right? They don't really care
that'd
about
be
the
so much
name or the
fun,
record
right?
number, right?
Yeah.
But they don't clear that out. It's not like they've given you a clean set that's unidentified or de-identified. So you're going to have some issues with that. So what you really need to do for the policy, getting back kind of the idea behind it is, one, you need to figure out as an organization what your approach is going to be. Are you going to embrace it? Are you going to embrace a lot of it? Or are you going to embrace one vendor? Or are you going to onboard that yourself and have some sort of on-site
Like
own build?
like a private
Right.
Gen AI.
Are you going to do that, or are you going to go out and buy that and just kind of engage with somebody? I know Google with their Gemini, they were looking at their Google Health product. They were looking at, hey, how do we get this into these healthcare situations and healthcare organizations using Google Health, using their Gemini product. And ultimately, there's several out there that are more specific to healthcare. But either way, it doesn't matter what industry you're in. You kind of need to sit back and say, okay, we need to introduce what we consider to be generative AI. So you got to define that for your organization, and you got to establish what your risk or your approach is going to be. We are going to use AI for X, right? You got to kind of get a good structure on how you're going to deal with it, how you're going to approach it, and if your leadership is on board. So prior to maybe even doing a policy, you might have to have a strategy type of discussion about how we're going to do this organizationally, because the policy becomes only one part of that strategy.
Okay, so I love that approach, right? Talk about strategy. How am I going to do it? The first thing, as the CEO of a company, I'm going to ask. All right, yeah, we want to adopt generative AI. I'm going to come to Jeremy and say, what's the risk? What risk do I have in using ChatGPT or Gemini, one of the public Gen AIs? What is my risk exposure? So
Yeah,
healthcare, let's talk specifically healthcare because healthcare seems to be the most restrictive. That and
yeah,
financial and
yeah.
healthcare are kind of
Healthcare
in.
and banking. Yeah, I think you get some heavily regulated industries. Mm-hmm.
So what's my exposure, right? If I just say do whatever you need to do with Gen AI to help with whatever you're doing inside healthcare, which could be patient care, it could be processing records, there's a lot of going on there.
Right, right,
So
and that's
where's
why
my
I'm going
biggest risk? Where's my biggest
to.
risk?
Well, that's where I'm going to start. I'm going to say, well, what are you doing with it, right? What data set are you actually invoking? Because that's going to determine. You probably have a lot of different risk levels, depending on the sensitivity of the data, the volume of the data, which vendors you're using. I had conversations with OpenAI and their ChatGPT product, and they really don't necessarily want the identifiers. they actually try to avoid having some of those identifiers because they don't need the liability of themselves, right? They actually want to have a data set, but they don't want to have that data set tied to a specific patient number or patient name. So they're actually trying to write some algorithms that they can de-identify or isolate some of those personal identifiers, which I found really fascinating in their algorithmic approach, because I don't know how they do that, but that's what they tell us anyway, or that's what they told me. So you're right. The risk you have varies depending on what you're inputting. It's pretty much a direct correlation, right? The more sensitive the data, the higher the risk of that compromise. But we can walk through that, because we're going to walk through and say, okay, well, let's look at all of the use cases that you want to have it right now, or we currently have going on right now. And let's start there, right? That's the part that I would start and say, what are we using it for right now? How is it helpful? And let's walk through some of those risks and what we can do to reduce that risk.
So wait, I got to back up a second. How do I capture how it's being used right now, especially in a large organization where I've got
Yeah,
thousands of employees?
It's a tough one. It's a tough one. We have, I've worked with some of the IT side or the information security side, the cyber guys, and they're going to be looking at, hey, what hits, what calls, right? What actually URLs? What are we sending? How often are we going there? Right now, let's a real time. Who's on these following websites that are tracked, or we assume that are AI? We've actually gone out and said, oh no, real time. This is our network. You can go ahead and search who's on what sites right now. And it was surprising. We did that at one time, just during a meeting. It just came up, and I said, well, let's go do this. And there were like 69, 70 accounts, somewhere in that neighborhood, of individuals that were medical professionals, so licensed practitioners, that were on, I believe it was an OpenAI server at the time. And then you had a couple on Gemini. Then you had a couple on it. So to catch it real time, you try to figure out who's using what real time. Then it's virtually impossible to say, hey, we know everything that our system is doing. But that's where you got to start. You got to try your best to figure out what systems are people using, what servers or what services are being used. Is it Claude? Is it ChatGPT? Is it Gemini? And for example, I know one other healthcare system, not the one I was with, but one other healthcare system decided to blacklist those and signed a contract with a particular service provider. Went through, signed up, had a business associate agreement and everything. It was really interesting how they got this done. But then when they opened it up, they said, you can use AI to do your projects, and you can have a lot more comfort with even proprietary or personal information, because we have a restrictive agreement, and this is how it's going to be used and taught, and how the LLM is going to learn, et cetera, et cetera. But to get to your question, back to that, how do you tell who's doing what? It's really, really almost impossible to tell every use case.
The company can take a look at data. That's well within your rights, right? As a company.
Sure. Yeah, you can and you should be able to identify who's where on your network and figure out where the data is going. Like I said, it's hard to do it because it's all real. If you're doing it real time, you can then start creating that list. Okay, these are the providers. These are where they're going. Gotcha. And now we know, hey, we can have interviews. And we actually did interview several of these physicians and some of the other affiliated providers and say, hey, what are you doing with ChatGPT? Or what are you doing with this? We're curious. We don't have a policy that says you can't do it right now. And at the time, we did not. So it's like, what are you doing? What's the use case? And how can we get on board with making sure that we're doing it in an ethical and secure way?
I really like that approach, because what it is, all right, we're going to open it up, but monitor, and then understand how people are using it, and then go back and talk to them, and now come up with a policy. The policy may be training. Maybe we need better training on PPI, but we still let people use it. Or maybe we run filters on every query that goes to one of these sites and rips all the PPI out, right? I mean, there's techniques that can be used to do that. But what I like the first approach, which is, hey, let's find out what's going on first.
Yeah, I mean, the reality is no leadership team knows exactly what's going on. Even in a small company, I think you might be a little bit surprised, what happens when people have a leash, right? They just go and there's like, hey, I want to explore, I want to do these things, and there's not a bad intent. It's actually probably really good curiosity to explore and to do these things, to innovate and to use this technology in a way that's going to make it more efficient and more effective. I think that's the step that I've really embraced, is to try to get a good sense of what is being used currently by talking to the people who are doing it. And again, there's not really a sanction or there's not really any sort of disciplinary action. It's just, I want to know what you're doing. Now, if I see something that's absolutely, critical, I'll stop that and we'll make sure that that's not happening.
Yeah, like sending passwords to the
right,
dark web.
right, right. I mean, probably not a good idea. I know ChatGPT actually will say, hey, if you upload a password, upload something, it will actually tell you, hey, that's probably not something you want me to have, and I suggest you go change it.
Yeah.
I've seen that happening lately, where they're trying to educate. But your second point is my second point, is you find out what's happening and then you educate on how you can do better. The number one thing of your policy is really going to be just an overarching, hey, this is kind of the generalized approach we take to AI. We might have a few rules that are very specific, but the majority of that policy is going to be very general. I think that's the best way to do it. What you do need to do, instead of making the policy more detailed, is all of the accompanying documents, so the training, all of the the acceptable use cases, all of those. That's going to be in a separate governance kind of structure, not necessarily in your policy.
So that will change more often than your policy.
Yeah, because
Right.
you've been in companies where policies take forever sometimes to get rewritten. Right?
At Intel, when GenAI first came out, the first policy hit in February of after the November release. So in February of 2023, our first GenAI policy came out. It has been almost 3 years. We've had 15 policies.
Yeah. So, and
It's
you're on
gone.
one.
It's gone for total restriction to wide open to everything in between. But I think your approach here is make it more general, back it up with training and guidelines, as those are going to change because it's changing so quickly. We need to adapt, right? As we see
Right.
new things.
I think there's something about a generative AI policy that people are treating it the same as other policies, like an HR regulation or something like that. The reality is your HR laws don't change, even your privacy laws, right? HIPAA or whatever, they don't change nearly as often. Generative AI right now, and I'll use specifically generative AI, that term, but I think what you're finding is the US doesn't really have, the Biden administration came out with, hey, here's our goal on generative AI. And the Trump administration said, no, we don't like that. Here's our new approach to it. Meanwhile, the EU's out there doing their thing. And China's even weighed in and said, yeah, we're going to win this war of AI and we're going to beat you all. Here's our framework. And everyone's like, wait, what? Like, so you can't really go with, hey, this is what the prevailing legal requirements are. You kind of have to back it up a little bit in the AI side and say, what are some of the basic ethical type of arrangements that we want to make sure that we're using AI and we're comfortable if a regulator comes in after the fact now, right? Because the regulations are up in the air. If they come in, we can at least point to a logical A, B, C process that says, here's how we evaluated the risk. Here's how we knew that we could use AI in a way. So your policy is going to be that generic structure of, here's our approach. And it's probably not yet anyway, going to be a very specific legal framework, like the NIST AI risk management framework, right?
Right.
The federal side, or the EU AI Act, which has some very specific type of things. I think everyone is a little bit just up in the air right now. So my approach to AI is, you have to have an show your work methodology here. You can do a lot of things. There's a lot of gray area, but you have to be able to show your work in a way that a regulator is not going to say, hey, that's just willful and wanton misbehavior, right? That's just reckless.
Gotcha. So, because there are no regulations, the best thing to do is to show your thought process. So, be very explicit in how you got to where you're at. So, the
Right.
supporting documents are going to be very important here.
Right. You're going to have in your policy, you're going to have to say, hey, here's our governance structure, right? Who's actually running it? Who's our role? Where are the roles that are running our AI program? What are their functions? What do they do? Like legal compliance, obviously your IT side, but your strategy, your HR, someone has to be in there. Who's making the policy? Who's reviewing the policy? And what's that cadence look like? Are there any working groups under that to say, hey, we want to make sure that we are doing use case analysis or, in privacy or security impact analyses to different product or different ideas that come up?
So this sounds like risk management 101.
Yeah,
It really
you'd be
does, right?
surprised. You'd be surprised how many people are just throwing that out the window and running around saying, "Oh, this is AI. It's great." Well, no. Fundamentally, back to our first point, data is data. It is. It's very similar in how we want to approach the fundamental part of it. We want to manage the risk, assess the risk, which comes really fast with artificial
Oh yeah,
intelligence
yeah,
and
it
the
does.
motion going on right now.
Well, before we talk about the different types of risk, because generative AI brings out some different new types of risk. One thing I would drill down a little bit on here is um, establishing this policy does not need to be restrictive of the use of Gen AI. It's more of a we're monitoring it, we're watching it, we're gathering use cases, we're trying to understand what it's doing, and we're documenting how we're doing that. Is that the right approach right now? Because the EU has been, we're going to lock this puppy down. And then what happens? Innovation goes nowhere. And then people try to subvert the policy, right?
Yeah,
So what
I
you're
mean,
talking about is a lot more monitor, watch. And then if something goes outside the bounds of the other policies that we have, then I need to step in and correct and train and things like that. Is that kind of the strategy here?
yeah, it depends on where you're going to go with it, though, right? Because if you're actually in the EU or you're part of that framework,
Well, yeah, then
you
you have
might not be able to do what I think right now is the good approach is take this artificial intelligence movement because this is going to revolutionize a lot of things. The concern I think from a risk standpoint and from a governance standpoint is, well, do we even want it to revolutionize certain things? First of all, is it actually giving us a benefit? So I think there's some things that from a strategy standpoint, it makes sense to kind of monitor and not necessarily stifle. And I believe actually, again, I'm no political viewpoint here is intended, but I believe that's the current kind of U.S. federal approach is we don't want to stifle that. We actually want to kind of try to put something out there that challenges innovation, right? That actually is much more iterative. Well, it comes with its risks, but that's how I approach the policy making for AI. As I want it to be much more allowing for a lot of innovation, a lot of exploration with some guardrails that really haven't changed. The California AG actually sent out a memo. Well, sent out two. One said, I think we talked about this last time I was on. One said, hey, AI in general, there's some guardrails. All of these other regulatory frameworks that we have still apply to AI, guys. And then they sent one out specifically for healthcare and said, you have to have this going on in healthcare too. And remember, a doctor is who has the license and they have to be providing healthcare. AI should not be providing the healthcare directly and making healthcare treatment decisions. It can augment that. And I think that approach is actually kind of a wise approach. We have frameworks. We have data, privacy and security and all of these types of things going on. And when it comes down to it, AI is still ones and zeros, right? AI is still
yeah,
data.
yeah, yeah.
And
Yep.
we want to make sure that we're managing that in a very similar way. But what I think it's data that's doing things that we haven't really seen before.
Well,
So
that's
it
that's the other part of this, right? We don't have any policies around
right,
liability on a Gen AI that's actually creating
right,
new
right.
things, right? Whether it's
Mm-hmm,
a new treatment
mm-hmm.
that we've never seen before. I can imagine surgeons coordinating, working with Gen AI to come up with new ways of doing, instead of open heart surgery for Darren, maybe we can, do it another way without cracking his chest open, right?
Yeah, yeah.
Um, and if something goes wrong, who do I blame? A Gen AI? Do I take Open AI to court? And and I kind of wish there was no blame type things here, um, but Gen AI is now creating. It's generative. It's generating
Right.
new things, right?
Hmm.
So this is a new risk area that we've never seen before because machines have never really generated new concepts or new ideas. And people may argue with me on this that it's not generating anything new. I beg to differ. I really.
Well, I mean that's its whole purpose, though, right? Is to predict that next thing, right? An LLM
That's
in
exactly right.
itself is predicting something and creating something that's not necessarily, well, it isn't existent when it generates that, right? It takes the pattern, it takes all of the recognition, and it says, well, based on all of this, what's next? And it comes up with something that's informed, but it's still something that's not existent. So I would agree
And
with you. I think it's generating something.
it's something, but we don't know if it's good or bad yet.
And that's
Um,
and that's part of that's part of the concern, right? So if you get into, especially in the healthcare world, the risks associated with AI, you have, first of all, you have to even set up a process to identify what those risks look like, because everything, healthcare will be one, but other industries, you won't have the same risk. You'll have similar, but you won't have that same levels of risk in certain
well, you do
cases.
in the Department of Defense.
Sure,
Oh,
sure.
that's a new target. I'm gonna
Yeah,
blow it up out of the water. Oh, it happened to be, you know, a surfer.
right. And you'll have those risks, right? So in terms of AI risk management and types of risk, I mean, you have all sorts of different things from the privacy side, from identification, right? All of the PPI, all of that personal protected information, if you want to use that phrase.
Right. So
PII
the
is
first
what
one is data
California uses.
loss or data, right? Not just data
Hmm.
loss, but data compliance. Can data
Right. Right. And how does that interact? Like, how, if you're really creating something and you're putting it into this LLM and you really can't take it back, you
no,
really
really.
can't walk it back, right, out of the LLM and say, oh, you can never remember that. You can, well, how does that actually work with data privacy or the right to be forgotten, as outlined in, like, the
The
GDPR, or
DPR. Yeah.
California has a very similar thing, with CCPR or CCPA. How do you go through, and how do they interact with each other? And that's where I think the real interesting intersection with the technology and the law will be will be really focused on for a little while, if not forever, really, because how do you deal with that, right? It's not really who
Well,
owns the data, who
that's
generated it. Well, is it OpenAI's or is it mine as the user, right? I
yeah.
don't know. There's another idea, another risk you have. But as you identify these risks, you have operational risks. The data might be leaked. The data might be re-identifiable. You have legal risks, even to the point where I have a legal strategy that I'm asking one of the AI models to say, hey, if I have this, these are the facts of my case. I put all this information in. Well, guess what? Is it searchable? Like, okay, how about I connected it to my Google Calendar? Does that open up my Google, like, my whole system? Like, maybe. So there's a lot of risks that I see that I'm like, huh, these are really fascinating risks that I think, as from my perspective, as the risk mitigator, the risk identifier at least. I'm working with the IT folks and the strategy folks, the innovation folks, to say, I love what you're doing, but we have to remember a few things as we're doing them, right? We have to be a little bit more cautious on how we're going to approach it. Let's do some things with some models. Let's figure out how it works. Let's drive that change with some de-identified information. Let's drive that with some other data sets that make more sense to, if even if they do get into the wild, I'm not going to be
You're
devastated,
not
or
going to
we're
be
not going
damned.
to have a compliance problem.
So most of the risks that you've mentioned so far has been around data and
Mhm.
all the different aspects of data. Are there additional risks that we have to deal with in that? Oh, how much do I trust the results that I'm getting back? And I'm making
Sure.
decisions based off of. You mentioned explainability. Is it explainable how I got to the results that I got? And so to me, this really calls out, and maybe in an AI policy, you have to have this trust and oversight that we as humans still have the final word, and still the buck stops with us still, right? Do you see it going that direction, or do you see people completely relegating decisions to AI moving forward?
Well, I think people want to let AI make the decisions. I think that's the easier way to do it.
Well, because then they have no accountability.
Yeah, but I think the what I really see though is, despite that want, um, I think that there really has to be the operational oversight and the governance. This person in the loop concept that you read a lot about, right? There's
Right.
got to be somebody, some knowledgeable person, even not just a body, but some knowledgeable person who can look at what's going on and analyze and say that's not right, or something's a little off here, even if they can't identify exactly what it is. They need to go through that validation of the data, right? In healthcare, one of the big issues that I find to be a stumbling block is how that model has been trained. What is that? What are we going to do with the information, right? Where we have this great use case, but we're not sure that the data is reliable in the first place on how that model was trained. So when you look at,
Are the wait just a second? Are the big public Gen AIs, are they willing to give out how the models were trained?
not really. No, I mean, there's really not a good bias test that you can say,
Yeah,
hey,
because, I mean, they're all biased. We all know this, right? I
sure,
mean,
sure.
but
And it's hard to
store it
track,
darkly.
right? And it's hard
Stock
to track
bias,
what the bias is.
right?
And that's part of the problem is they're even if they say they're open, it's sometimes a little hard to get to, well, what's the data set, or what it was the data that you actually did train this on.
And what data
Um,
did you not train it on?
right. Did you exclude? If you're looking to treat a certain condition that's more prevalent in an African American population, and that model's been trained on Asians or white population, you're not going to get the results that you think you need, right? You're not going to get the most effective results at all. And so that role-based training, that bias testing is kind of tricky. So that risk right there to actually, and I don't want to say really it's hallucinating, because I think that might be a little too far. It's
Right.
just, it's
No, this is
doing what
just
you
a blind
expect it to
spot.
do.
This is
Right.
just
It's
a
just
total
blind.
blind spot.
Right. And
Oh,
so
you know what, Jeremy? We just coined a new term: AI blind spot. It's a blind bias, right?
it is.
It's
It is.
totally true, right?
And we go through bias training all the time as humans, right? We have unintended type of consequences for our natural unknown biases, right? Our inherent biases.
Our inherent
AI
biases.
has an inherent bias, and no one can identify what that looks like on the back end because we're not sure what the data was. So we have this transparency problem, with this bias, and that leads to kind of what you talked about and mentioned, that the explainability. There's reputational risks behind relying on AI. If I want to say to you, as my customer, as my patient, as my whatever relationship we have, you can trust me, and I'm using a model that's not trustworthy, you're going to have a potential disconnect there, and that delta will lead to the risk, that residual risk of what risk do you have.
This is going to be really interesting, Jeremy, because I could see someday me as a patient going to a doctor, which Gen AI do you use? Which model do you use? Oh, well, I use OpenAI. I'm not happy with their medical bias. I'd rather you use Stanford's Gen
Yeah,
AI,
yeah.
right? Or or the Mayo Clinic's Gen AI. But it's fascinating, because how many of us will ask a doctor where they graduated from?
Yeah,
Some people do. Some
yeah,
people do.
it might make a difference, especially on the first meeting.
But
But
yeah, it's a really interesting concept, because our doctors are biased based off of the medical school that they go to,
sure, sure.
right? I mean, obviously, right? Because that's
Hmm.
where they learned, right? there's this whole Western medicine, Eastern medicine. There's the conflict between MDs and DOs that is out there, right? And there's all these different things going out there. I think Gen AI just introduced another potential thing. It may be in the future, but these blind spots I think are real and can raise their heads sometimes. Hopefully
Yeah.
not in healthcare.
Yeah, and that's one of the things I think that even the healthcare CEOs that I have heard speak or talk about, they really want to use it in a way to use AI in a way that effectuates the most change, but yet it's not too crazy. They're not allowing it. They understand they're not trying to allow it to diagnose or do anything. But what it's really helpful for is, hey, can you analyze 1 million of these mammogram images and then help me, the physician, say, based on those pattern recognitions that we've done,
Do we have
does
anything
this
in the
one look like it's trending in that same way? And then they can give them that help that they need to augment. I actually know a couple of medical directors they don't use artificial intelligence as a word. They use augmented intelligence because they can't understand. It just doesn't make any sense to be artificial. That's not helpful. We don't
right?
want
No, you want it
artificial.
augmented.
We
Yeah.
want augmented. We want to be able to be better. And
Well,
so
I
that,
already told you. You got to go to my shop and buy the augmented shirt, right? AI augmented shirt,
mhm, that's
right?
right.
So we
That's
can all
right.
walk around augmented by AI.
Yeah, and that's what Mark Zuckerberg was talking about with his glasses, right? If you don't have the glasses that are AI enabled, you're going to be behind. I'm not sure that's true, but that's his idea, though, right? You're augmenting what's going on, and I think that's really the kind of his vision. I'm not sure that's not necessarily true, but it might just be feeding his own machine. I don't know, but it's maybe a thought that I've had. But it makes some sense though, right? Because the augmentation might be helpful. The augmentation actually might prove to be really productive.
Well,
And
I
so,
would want I would want my doctor to be augmented by an AI.
well, yeah, and I think we talked about this last time. You asked
Yeah,
me whether I would go, and I agreed. I would want the help. I would want the augmentation because I think there's value in that mass amount of data being processed. I do
right.
think it's
But
helpful.
it's not replacing my physician. It's helping my physician understand better what's going on because there's no way we can keep it all in our head. There's absolutely no way.
Right, right, and that's what, getting back to the very beginning questions, that's what the policy side of the strategy side should
Got it.
do for you, right? That's exactly, coming full circle, that's exactly what it should do for your organization, is say, how are we using this to augment what we do in a responsible way to mitigate some of these risks? I mean, we talked about a couple data, there's some ethical risks, legal risks, maybe some IP or copyright type of risk.
Right. Right.
You might leak information, but that's data. You have some reputational type of harms that might come about. So there are some risks, and they're not really that different than anything that we've seen in terms of how you name the risk. But I do think that this will take a lot more continuous monitoring of the risk and iteration between more teams than ever before. Because legal, compliance, IT, they all need to be lockstep in the AI world because the use cases keep coming. For
Yeah.
example, I think it's rare that you have, and I'll use healthcare because that's where I'm in, but it's rare that you're going to have a nurse come up and say, hey, this is what I need for this computer program, this software,
That
right?
never
They
happens.
usually have software and they're kind of constrained. I mean, you have the EMR, the EHR, and you have that there, and they'll say, okay, I don't love it, but I'm going to use it within this constraint. It'd be nice if it had a function. That's true. But now you're getting nurses coming to the IT side saying, hey, I want to use AI for this, and this, and this. And you've never had that type
Never
of
had that.
interaction before. So the number of use cases or the proposed use cases coming up to the governance body, whatever that looks like in your organization, whether it's one person, whether it's a committee of 40, which is too big, by the way. Um, but if you have this, whatever's coming up has to be evaluated in a very quick, timely manner to gain the most benefit for it. Because you'll lose that innovative spirit, you'll lose that curiosity if you don't approve some of these. But at the same time, you have to have that system set up to be nimble enough to do it in a very responsible way. hey, we're going to take a
Maybe,
data set, we're going to de-identify it, we're going to use it in a sandbox, and we're going to see if this works.
well,
You know
maybe an
what?
AI should be doing that.
Right.
Maybe an AI should be part of your governance model.
And maybe that's true. And that
Yeah,
might not hurt, right? To have, hey, what aren't we thinking about even? They're great at issue
they're
spotting.
great at that stuff. Yeah. Hey,
Right.
Jeremy,
And
this has been wonderful. We're out of time, of course, but you
again,
and I we could talk forever. So, but it would bore the audience.
that's true. That's
If
true.
people want to reach out to you, Jeremy, they reach out to you on LinkedIn.
Hmm. Yep.
Is that the best? Yeah,
Yeah.
LinkedIn. Jeremy
Yeah.
Harris.
J Harris Privlaw at Gmail. There's an email for you. Or
There you go.
I think that's the profile name on LinkedIn too. It's J Harris Privlaw. Yeah, reach out. I'm happy to have conversations about it. Happy to discuss it.
Awesome, awesome, Jeremy. And hopefully this episode will carry on like your others have. They've been quite successful carrying. And for my listeners that don't know, embracing digital transformation is now #1 on Apple Podcasts in the technology category, which is amazing. I don't even believe it. We'll see how long we stay there. Maybe a day or two, hopefully a week or more. So keep listening. And Jeremy, thanks for coming on the show.
Thanks for having me again, Darren. Appreciate it.
Thank you for listening to Embracing Digital Transformation today. If you enjoyed our podcast, give it 5 stars on your favorite podcasting site or YouTube channel. You can find out more information about Embracing Digital Transformation at embracingdigital.org. Until next time, go out and embrace the digital revolution.